Hey everyone, we've got another heart today. This is number 109 in our collection, and we'll start off by going through a teaser or preview of the main phenotype of this heart. So we'll open it up here, and as soon as we open it up, we can see a few things. That we are dealing with a common atrioventricular junction. There is a oval fossa ASD, but as part of the common AV junction in the atrioventricular septal defect, there is an atrial level shunt as well. Here's the superior bridging leaflet with its left and right components. And here's the crest of the ventricular septum here. And when we lift up the superior bridging leaflet, we see that it doesn't have direct connections to the crest of the ventricular septum. Remember, here's the crest right here. And here's the superior bridging leaflet being lifted up by the probe. In fact, when we follow this over, we see that there are chordal attachments to a papillary muscle to the septum on the right. So a Rastelli B atrioventricular septal defect. But let's go back to the heart and how it would have sat in the chest. The heart would have sat in the chest like this, with the anterior surface towards the screen, posterior towards the turntable, head are superior here, legs are inferior here, left over here, right over here. And then let's start off as we usually do, which is by identifying what at least externally we think is the right atrial appendage. And here we've got an appendage that's triangular, broad-based or pyramidal in shape. And here's what looks like the superior caval vein coursing into that. So why don't we go ahead and open up what we think is the right atrium. And here, in fact, is the superior caval vein draining into the roof of this right atrium. We know it is a right atrium because there's pectinate muscles that spill outside the confines of the appendage. And we see that there is an oval fossa atrial septal defect here. And then here is the mouth of the coronary sinus. And then here is the atrial component of an atrioventricular septal defect. So important to highlight that there is, in fact, a true atrial septal defect here, an oval fossa defect, and then here's another atrial level shunt, but what's truly an atrioventricular septal defect, and not truly an atrial septal defect, which this oval fossa defect is. We usually talk about the triangle of Koch at this point, which is bounded by the coronary sinus, the tendon of Todaro, and the right-sided atrioventricular junction. Obviously, that does not exist in the setting of an AVSD, and in fact, there is the triangle of Thien-Anderson. And so the atrioventricular node in these hearts is in fact displaced and would sit roughly here. Now, when we look at this atrioventricular junction, we know that this is a common atrioventricular junction, and we can look at the components of the common atrioventricular valve. So you'll recall the atrioventricular valve has 5 components: the superior bridging leaflet, the inferior bridging leaflet, the right anterosuperior leaflet, the right inferior leaflet, and then the left mural leaflet. So here we're looking at the right ventricle. We know it's a right ventricle because it has coarse trabeculations. And we'll look at the septomarginal trabeculation here. And here, in fact, is the septomarginal trabeculation. And you can see its cranial and its caudal limbs here. So this, in fact, is the morphologic right ventricle. And so here we see the superior bridging leaflet. Here's the left component of it. Here's the right component of it. And then here is the ventricular septum. And here is the crest of the ventricular septum right here. So this ridge right here is the crest of the ventricular septum. And you can see that when I lift up the superior bridging leaflet, there are no connections between the superior bridging leaflet and the crest of the ventricular septum. So we do know that this is not going to be a Rastelli A. And as we go over and follow the superior bridging leaflet, we do find its chordal attachments here, and we see that they're attached to a papillary muscle that's attached to the right side of the ventricular septum, consistent with a Rastelli B. So here's the superior bridging leaflet coursing over the crest of the ventricular septum from the left ventricle over to the right ventricle. Here is the right anterosuperior leaflet. Here's the right inferior leaflet. Here's the inferior bridging leaflet that also courses over the crest of the ventricular septum and has direct attachments to the crest here. So the superior bridging leaflet, no direct connections to the crest. The inferior bridging leaflet does. Here's the right ventricular outflow tract. You can see the superior bridging leaflet here. We come across our first arterial valve here that does have 3 leaflets and 3 sinuses. As always, note that the pulmonary valve here is supported entirely by muscle, and that these half-circle fibrous valvar leaflets do have these interleaflet triangles interposed in between them, and there is no true round or oval annulus of the arterial valves. That's a human-made structure, and although it's a helpful tool clinically for interventional planning, it isn't a real anatomic structure. Here's a pulmonary trunk from which does arise the right and left branch pulmonary arteries. Here's the posterior aspect of the heart. Here is the left atrial appendage. And we can see that the pectinate muscles are confined within the appendage here itself. And now we find a smooth-walled atrium consistent with the morphologic left atrium. We can see where one of the pulmonary veins comes in. Here we see now from the left atrial view the oval fossa atrial septal defect and the atrioventricular septal defect. Here's the atrial level shunt as part of that AVSD. And now we can see the crest of the ventricular septum here from this side. Coursing over it are the superior bridging leaflet here, and here's the left component of that superior bridging leaflet. Here's the inferior bridging leaflet here, which does have direct attachments to the crest of the ventricular septum. And then here is the left mural leaflet. So left mural leaflet, inferior bridging leaflet, and then the superior bridging leaflet here. This ventricle here has fine crisscross trabeculations consistent with the morphologic left ventricle. You can see the scooped out appearance of the ventricular septum here, consistent with an atrioventricular septal defect. And you can also see that the inlet of this heart is significantly shorter than the outlet component of this heart. And here is the entire outlet of this heart. So here's the LV outflow tract, and then here's the inlet. And you can appreciate the discrepancy in the inlet to outlet dimensions here. Also of note, as we get into the left ventricular outflow tract here, that the aorta is sprung forward. The aortic valve is no longer wedged in between 2 atrioventricular valves, since there aren't 2 atrioventricular valves to be wedged in between, which helps create that inlet-outlet discrepancy and the so-called gooseneck deformity that can be seen by angiography or by echocardiography. Here is the second arterial valve, 3 leaflets, 3 sinuses. And there is some fibrous continuity between the superior bridging leaflet and this arterial valve here, which in fact is the aortic valve. And once again, this aortic valve has 3 sinuses and 3 leaflets. And here's the ascending aorta here. So once again, a heart with an atrioventricular septal defect, a Rastelli B. Here's the inferior bridging leaflet. Here's the left mural leaflet. Here's the superior bridging leaflet from the left. And then when we go over to the right, we see the superior bridging leaflet here, the right anterosuperior leaflet here, the right inferior leaflet here, and then the inferior bridging leaflet here. Here's the crest of the ventricular septum here. No direct connections between that and the superior bridging leaflet. And we see that the superior bridging leaflet has connections to a papillary muscle to the right side of the ventricular septum, consistent with the Rastelli B. Also a point to note that from the left side, the alleged cleft that the surgeons close, or that we appreciate by echo, is actually just a zone of apposition. Generally, that's between the superior and inferior bridging leaflets. And it's not a true cleft, meaning that it's not a true deformity in the valve leaflet itself. It's actually the zone of apposition. And so most times what the surgeons are closing is actually a zone of apposition, or an area of the zone of apposition between the superior and the inferior bridging leaflets. And so that's an atrioventricular septal defect, Rastelli B.